When helping the Rodriguez family, it would be vital to recognize and consider the cultural differences this family experiences that I might be uneducated about. It would be beneficial to do research about the culture and common issues this family might face in the community they live in. It would be beneficial for myself and the family to gain a better understanding of what they face as a Hispanic family in addition to the specific family issues they are facing. I would want to avoid assuming anything about the family that would correlate to experiences of my own. The textbook states that Hispanic families typically feel more comfortable in counseling situations when the therapist is open and expresses humility in the form of sharing personal stories. I would want to embrace that and avoid being too clinical when assisting this family. I would want to use personal experiences without overshadowing the fact that there are cultural differences that they may not relate to. The textbook also discusses that a therapist would want to avoid challenging the different familial hierarchies that Hispanic families typically have. Hispanic families tend to adopt a patriarchal family style in which the father is the head of the household and makes all the decisions. This is something that I am personally unfamiliar with, but I would not want to challenge this idea as it is a cultural difference that should be understood, not challenged. Another thing to be sensitive to would be anxiety when working with undocumented immigrants. If the Rodriguez family was of undocumented status, they may be very anxious about being deported. An article published in Counseling Today suggests that many Hispanic families that are undocumented will not seek counseling help because they are afraid of being deported and their information being shared by the therapist to government entities. It would be important for me to make sure that they understand that confidentiality is required and that no information would be shared with anyone. It could also be a good way to assist them with obtaining documentation or citizenship and fulfilling that role as a therapist. Hispanic families face many institutional barriers, including deportation and poverty. The church is a great resource for them, and it might be good to research the community for recreational programs for the adults and the children to assist them in acclimating to living in a different country and possibly form a sort of network in the area.